Hi guys, it's Breast Cancer Awareness Month and we are very honored to have a doctor from Medifem Hospital to share with us some of the things that we can do to prevent ourselves from catching breast cancer. So when we come back, Dr. Suleyat will be joining us. Hello, Dr. Suleyat.
Hello.
Welcome to Ameyaw TV.
Thank you.
So it's Breast Cancer Awareness Month. Tell us, at what point should people start screening for breast cancer?
Okay, so everybody should screen for breast cancer. Anybody that has boobs should screen for breast cancer. So it doesn't have an age cutoff really, but a better purpose, I would say probably from the age of 17 going, you should screen your breast.
Okay, so how often does one need to screen? Is it monthly, yearly, or quarterly? How often?
So it's something you're supposed to do monthly. There are things you can do monthly and there's some things you can do yearly.
Okay.
So for the monthly part of things, you're supposed to check your breast yourself. So we call it self-breast awareness. So you do it every month. Usually for women who are still menstruating, we say a few days after your period. So like 2 to 3 days after your period, you check your breast monthly. And for those who have stopped menstruating or those who are not menstruating at all, then it will be, you choose a date in a month that is easy for you to remember, whether the first Saturday or your favorite number, and stick to it monthly and check your breast.
Okay, so when you say monthly, that's a lot of checking. Yes. For people. So are we checking it ourselves?
Oh yeah, so it's self-breast examination.
Okay,
so you
for
do
the monthly
it
period
yourself in the house. You can do it when you want to have a shower, after changing from work, or dressing up in the morning, anytime you feel comfortable.
Now I know there've been a lot of videos or techniques on showing us by health professionals such as yourself, showing us how to do the self-examination. Are people able to do it by themselves really well as compared to a health professional?
Oh yes, people are doing it really well. I think there are so many videos out there and so many picture illustrations, and they are very simple techniques, so it's easy for everyone to do it. And we are getting a lot of people coming in complaining of one of the symptoms they are worried about. But the main aim of the self-breast examination is for you to know your breast. So some people have lumps in their breast that is there all the time. When they come to the hospital, we do their checks and it's normal. So it's for you to know your breast, so that if, let's say, such lump gets bigger or there's changes in it, you notice. Or whether, even if you don't have any lumps in your breast before, if you notice something different about your breast, you can pick it up early and go to the hospital, and something can be done before it becomes dangerous.
Okay. Now I know it's been a couple of years since creating awareness for breast cancer has become like really vigorous. Yeah. Is it making any difference? Are we seeing lesser numbers, or we are still seeing higher numbers since the creation of, deciding to pick a whole month to dedicate to creating awareness on breast cancer? So
I didn't read about the data, but from my own personal experience, I would say there's increased people being picked up with breast cancer, and whether the benign or the malignant breast cancer. And this is because a lot more people are checking their breast, whether self-breast examination or doing the yearly checks with the mammogram and the ultrasound. So because people are more aware of their breasts, we pick up more people with breast abnormalities. And what this has done is that it has reduced the rate of people who are, like, the prognosis. It has improved the prognosis. So more people are getting treatment early, which means things that could have killed them later on in years, they get better from it.
Okay, so there have been a lot of cases. People have died. Some people have lived on and have been cured entirely. But can it be prevented entirely?
No, breast cancer is not preventable entirely, because it's a genetic mutation in the cells that leads to cancer. You can't stop cancer from happening. The reason being, the older you get, the higher your chances of getting cancers. And that's why, because we are living longer, that's why we are getting more cancers lately. However, there are things you can do to reduce your risk. So, and then also the risk factors, it helps us doctors to know who to, pay particular attention about when it comes to some signs that people show.
Okay, so what are some of these things that people can do to prevent themselves from catching early, stages of breast cancer?
So before going to that, I would like to talk about the risk factors first, because I feel like if you know the risk factors, then you know what you can do.
Yeah.
So the risk factors for breast cancer, there are things you can modify, you can do something about, and there are things you can't do much about. So the ones you can't do much about is your age. So the older you get, the higher the chance of getting breast cancer. It is noted that between the age of 50 and 70, more people get breast cancer. Also, in our setting, late 30s also is another peak. There's a high chance of breast cancer around that age group as well. Then another risk factor is gender. So female gender is more prone to breast cancer than male. And this is because we have more breast tissues, so more chance of a cell growing abnormally. Okay. And then another thing you can't do much about is the genetic factor. So whether it being in your family, like your sisters having it, your mom having it, parents, or what you can do in that sense is maybe see a doctor and they can do something to reduce your chances of developing it, and also screen early so that when it comes, they treat it while it's still early and you can have a better prognosis out of it. And then there are things you can do something about. So the first one is, I know most women don't like to hear this, but it's the age at which you have your first child. So it is believed that the younger you are, the younger you are to have your first child, the lower your risk of breast cancer.
When you say younger, so at what age are we looking at this younger?
Early 20s, early 20s, late 20s. I know most women these days. Yes. So it's been noted that women who have their first child above the age of 30, they are at a higher risk of getting breast cancer. But that doesn't mean you get breast cancer. It's just that it's one of the risk factors. Okay. Another risk factor you can work on is breastfeeding. It is noted that women who breastfeed more are less likely to develop breast cancer as compared to women who chose to not breastfeed or who couldn't breastfeed. So all this has something to do with the hormones in a woman's body. So which leads me to my next point, which is hormonal medications. So women who are on some hormonal medication, especially estrogen-based medication, oral contraceptives, and then women who are in their menopausal age who takes hormonal therapy to reduce the symptoms of menopause. Yeah. Yes, so those medicines put you at risk of breast cancer. That doesn't mean you shouldn't take them. But when you are taking them, you talk to your doctor about it. He or she will weigh your factors and see, if there's a better option. If there isn't, he would know what to do, basically. And then also, your lifestyle as well affects your risk of cancer in general. So eating healthy, reducing alcohol, not smoking, those things tend to reduce your risk of getting cancer.
Okay. Now to my next question. There are a lot of myths surrounding breast cancer. I'm sure as a doctor you've heard some of them. But the most, I think, prominent one is the fact that men do not get breast cancer. Please, let us know.
No, that's not true. Men can get breast cancer. And there's been so out of 100 breast cancer cases in America, it is noted that one of them is a man. Okay. So men can get breast cancer, and there are risk factors for it for men as well.
Okay. Now I know Medifem always does something special on, to celebrate Breast Cancer Awareness Month. This year, what are you guys doing?
So this year, our theme is Your Breast Foot Forward, which...
I like that theme.
So basically, we are examining breasts, people's breasts, both male and female, of all ages. So you can come down to our hospital on Tuesdays, Thursdays, and Sundays to check your breast between 9 o'clock and 2 p.m.
Okay.
Yeah.
All right. What are your final words to anyone that is watching on breast cancer and, you know, the many ways that we can do to keep ourselves safe from it?
Okay, so practice TLC. Touch your boob, look out for abnormalities, and call your doctor if there's anything wrong.
I like that. On that note, thank you so much, Dr. Sulayat, for coming. And I hope my viewers will take all the things you've said seriously and we can help prevent ourselves from catching, you know, breast cancer. Thank you so much.